Today we are going to do the bones of the foot. The leg bones, that is the tibia and the fibula, they end on the foot bones. The foot bones are arranged in three layers. This one is the hind foot, the middle one is the midfoot, and the anterior one is the forefoot. So we are going to do these one by one. The first bone that is connecting with the leg bone, that is the tibia, is talus. This is talus. Talus has a head anteriorly, a narrow constricted neck, and a body posteriorly. The superior surface of talus, which articulates with tibia, is called the trochlear surface, and its inferior surface is concave and which articulates with calcaneum. The anterior surface of talus articulates with navicular. This bone is the navicular bone. It is articulating anteriorly with the head of the talus. The neck is constricted, and then it has a posterior process. The posterior process has two tubercles, a lateral tubercle and a medial tubercle. And in between there is passage of the tendon of flexor hallucis longus. Next one is the calcaneus. This heel bone is the calcaneum or calcaneus. The calcaneum has this anterior part and this large posterior part. Plus the calcaneum has 6 surfaces. One is the anterior surface, which articulates with cuboid here. One is the posterior surface, which is smooth in the upper part and rough in the lower part. Then it has a superior surface, which is also called the trochlear surface, which articulates with the lower surface of talus. Then is the inferior surface or the plantar surface. Then it has a lateral surface, which is smooth, having a fibular trochlea. And then on the medial surface, it has a shelf-like projection, which is called the sustentaculum talli. The calcaneum is the largest and strongest bone of the foot. The inferior surface has tubercles, the medial tubercle, lateral tubercle, and an anterior tubercle. Only the medial and lateral tubercles come in contact with the foot floor. Then in front of the tarsus and the cuneiform, we have a row of bones starting from the medial side. The navicular, the 3 cuneiforms in front of the navicular bone, and the cuboid on the lateral side. Navicular is a boat-shaped bone having a navicular tuberosity on the medial side. Posteriorly, it articulates with the tarsal bone, tarsus, and distally it articulates with the 3 cuneiforms. This is the medial cuneiform, which is the largest. This is the intermediate cuneiform, which is the smallest of the cuneiforms, and this is the lateral cuneiform, which articulates posteriorly with navicular and laterally with cuboid. This is cuboid. Cuboid is cube-shaped bone having a tuberosity on the lateral side, and there is a groove on the lateral side of the cuboid for the tendon of peroneus longus, which passes from here. Cuboid articulates with the 4th and 5th metatarsals anteriorly, and the 3 cuneiforms articulate with the corresponding metatarsals anteriorly. Then in the forefoot, we have the metatarsals, the 5 metatarsals counted from the medial side as 1st, 2nd, 3rd, 4th, and 5th metatarsals. And in front of the metatarsal, we have phalanges. 2 phalanges in the big toe and 3 each in the remaining 4 lateral toes. So this is the forefoot, comprising of the metatarsals and the phalanges. This is the midfoot, comprising of cuboid, navicular, and the 3 cuneiforms, and this is the forefoot, having tarsus and the calcaneum. The various joints of the foot are the subtalar joint, that is beneath the talus, which is the talocalcaneal joint, and the talonavicular part of the talocalcaneo-navicular joint. This one. This is the subtalar joint, and this one is the calcaneo-cuboid joint. So subtalar includes the talocalcaneal joint and the talonavicular part of the talocalcaneo-navicular joint, plus the calcaneo-cuboid joint. And the movements occurring here are the inversion and eversion. Inversion and eversion takes place at the subtalar joints. The rest of the joints are the intercuneiform joints, the metatarsal joints between the tarsals and the metatarsals, metatarsophalangeal joints between the metatarsals and the phalanges, and the interphalangeal joints between the phalanges. So the movement mainly taking place at the subtalar joint is the inversion and eversion of the foot. Inversion and eversion of the foot.